I was put on a TKI called sunitinib, and that has a median success of 2 years, and I've been on it 5, and that is said to have tolerable side effects, and I'm tolerating them. I had a bone met discovered in my right femoral neck, so I then had to have, in 2017, a hip operation where the part of the femur and the hip was taken out. But I now have been put on monthly infusions of zoledronic acid, so that's an additional treatment. The main side effects, in batting order, I would say, are fatigue. I also have gastric effects, diarrhea particularly. I suffer from malabsorption of lipids, so while I'm on my drug, I have to try and restrict my diet to what you might call a cornflake diet, where I'm eating breakfast cereal, which doesn't sound much fun. But then when I'm off my pills, which is 2 weeks on and 1 week off, when I'm off my pills, I do eat very well.
I was put on a TKI, sunitinib, as first-line treatment. Sunitinib has caused a lot of side effects, certainly in the early days. I had a lot of fatigue, I had a sore mouth, difficulties in swallowing. I suffered quite a bit from hand-foot syndrome, but mainly on my hands. The thing that causes problems is really friction. So taking sensible precautions certainly prevented that a lot by wearing gloves if you're doing any sort of manual tasks that will involve a lot of friction, twisting, whatever it might be.
Since the surgery, I had high-dose interleukin, nivolumab and microwave ablation. The side effects of those treatments were quite different. The high-dose interleukin side effects were really debilitating. At the time I had the high-dose interleukin, we had a very good GP and he was incredibly sympathetic towards all the side effects, and we worked our way through the drug options available to deal with the itching and the loss of skin and the sore mouth. And I think we did build up quite a stock of knowledge as a result of that. I then went on to nivolumab for 2 years, and the side effects were much easier with that. I still got certain skin reactions, and there was muscle aches and fatigue, but all of them fairly minimal compared to the IL-2.
You have to learn to manage your life and to do what you can when you can. I'm probably a bit better in the morning. I tend to fall asleep in front of Countdown and things like that. And again, I've had to definitely restrict my diet, wrap up a bit better clothes-wise.
Reluctant to commit to some things just because of the worry that you might get diarrhea. It plays on your mind, and it does eat away at your confidence to just think, yes, I can do this, I can do that, because you have to all the time think about, will I feel okay?
I still live a full life. Although I don't work, I am involved in voluntary work with my local rugby club and also with the county. So that gives me a focus apart from the family. Intuitively, one feels that a positive mental attitude can't do you any harm.
It's a bit of a mental battle almost, I think. I mean, one of the things, when people talk about fighting cancer, it's not about fighting it physically. I don't think you can do that. You need treatment to help you with that. The fight is all mental, really. It's trying not to let cancer rule your life.
Dealing with the initial diagnosis and the various treatments along the way has been very much an emotional roller coaster, because there have been periods when I was told that the disease hadn't spread, And then I had to deal with the fact that it had spread and the prognosis was very dire. Then there was the chance to get onto nivolumab, and that promised a real lifeline. I had to wait probably about sort of a year with that to start to see some very profound benefits from it. Then the effectiveness of that started to diminish, and I had to think about other treatments that might be available, which is when I had the microwave ablation as well, and that was quite effective. I stopped treatment 18 months ago, and there's been very little disease growth, but the last scan did show a flare-up of one of the lymph nodes. So it's a constant emotional roller coaster with the treatment. Sometimes you think you're making progress, and other times you think the disease is winning.
Keep calm. There are new treatments that can delay for significantly long periods of time, and they're coming online all the time. You know, there's never a good time to get kidney cancer, but if you're going to get it, it's never been a better time than now.
It is very difficult in the early stages to come to terms with it, but you gradually do refocus your life. For me, there's a new resolve. I can't change the outcome, but do I want to spend all day every day worrying about that, or do I want to get on with my life and do the things I want to do?
I think for other patients that are living with cancer, the one piece of advice I would give is don't bottle the problems up yourself. It's a very lonely journey dealing with cancer, and you need to share your experiences with others. Get in touch with a network like Kidney Cancer Support Network. There are a lot of people in the organisation that have gone through what you're going through, and share your experiences with them, ask for their experiences. It will make the journey a much easier one.